Well, good afternoon, everyone, and welcome to today's WIL Australia webinar, the National Code in Practice, Embracing Emerging and Best Practice Approaches for WIL. My name is Professor Caroline Urquhart, and I'm delighted to be moderating today's discussion on behalf of WIL Australia, in particular the Engagement and Advocacy Committee. Before we begin, I would like to acknowledge the traditional custodians on the lands which we meet today. So I am joining you from the lands of the Yugambeh people, and I want to pay my respects to elders past and present. And I want to acknowledge the continuing connections that Aboriginal and Torres Strait Islander peoples have to country, culture, and community, and recognize their ongoing contributions to education and knowledge sharing across Australia. And given that we are joining from many different parts of Australia today, I would invite participants to use the chat to share the country from which they are joining today. Before we continue, I would also like to provide a brief content notice. Today's webinar will include discussion of gender-based violence and case study scenarios involving disclosures and responses within the work integrated learning settings. And we do recognize that these topics may be distressing or triggering for some participants. So we would just invite you to please take care of your well-being throughout the session, and we encourage you to engage in ways that feel right for you, including stepping away if needed. If you do require support, we encourage you to seek access from the wellbeing services at your institution or through your local support services. And we will also be putting into the chat some support resources so that they are on hand if needed. So this webinar, we're really excited to bring it to you, follows the previous webinar that we had a few weeks ago where we were understanding the code and its implications for WIL practice at a bit more of a conceptual level. So in that first webinar, we focused on developing a shared understanding of the new code, exploring the policy context, the intent of the reforms, and what these reforms might mean for WIL. So today's webinar takes really the next step. So rather than focusing on what the code says, our attention will shift in today's webinar to what the code actually means in practice. And our goal today is to explore with you how you might translate policy into meaningful and effective responses within the context of WIL. So today's webinar has been designed in 4 parts. We're going to kick off the webinar with a good practice example from Deakin University, and they will share a little bit how they as a specific institution have enacted the code and created a support infrastructure. We're then going to shift gears and we're going to do a brief refresher on the overview, specifically around the role that WIL practitioners play in the space of disclosure. So just to give you that refresher that links back to that first webinar. And then third, we will then move to what we hope will be a really interesting panel discussion that will center on 2 case scenarios. And so we're going to present these 2 scenarios to you, and then we will have a WIL practitioner and a GBV expert talking through potential responses to these scenarios. And then finally, we're going to conclude the webinar with an open Q&A session, which we are hoping will provide you with an opportunity to raise any questions you have, to share any reflections, so that we can really continue the conversation from the panel. So that's a little bit the roadmap for today. And with that, I am absolutely delighted to introduce, I think, a very stellar lineup of panelists. And I think one of the real strengths of the panel today is it does bring together our colleagues from WIL and the GBV space. So delighted to introduce you to Rhiannon Tanner, who's the Senior Coordinator, Primary Prevention at Deakin University. Also delighted to welcome back Megan Sharp, who's the Gender-Based Violence Specialist at Griffith University. Larissa Mendoza, who's the Head of Inclusive and Respectful Communities at ANU. And also delighted to introduce you to Laura Birch, who's the Strategy and Impact Specialist at Monash University. And then hopefully a familiar face, the brilliant face of Faith Valencia Forrester, who's the academic lead, WIL, at Charles Sturt University, and seems to be involved in pretty much everything WIL related in the country. And I just want to also acknowledge, Faith, your work recently in pulling together yet another submission for the government on all things will related. So thank you very much, Faith, for your leadership. So with that, what an exciting lineup of panelists in front of us. So with that, I'm going to hand the baton over to Rhiannon, who's going to kick us off with the Deakin case study. So over to you, Rhiannon. Looking forward to you to learning about your good practice example.
Thank you, Caroline. I'm just checking I can drive the slides, and it does seem to be working, so that's always a good start. So I'm Rhiannon Tanner, Senior Coordinator of Primary Prevention at Deakin, and today I just wanted to present on our Respectful and Inclusive Workplaces Pre-Placement module. I do want to acknowledge that Laura, who's one of our panelists, was actually managing the team at the time that this was created and had a very big role in getting this off the ground. So did want to acknowledge that, and also the other team members who were involved. So we had our one of our lead trainers, Alicia Yu, our Safer Community expert, Alicia Stewart, and also our training and learning designer, Mary Rahabi. So I guess when talking about the drivers, about why we developed this module, we do know that students participating in WIL can face a number of challenges while they're on placements, and this can include things like new interpersonal and power dynamics, really variable knowledge about what to do if they're witnessing or experiencing inappropriate behaviour, and even recognising what behaviour is inappropriate. There's a lack of certainty about course progression or course implications of making a complaint or ceasing a placement. In some cases, there's no training on the ground when students arrive at a partner organisation to do their placements in relation to policies, procedures, and expected behaviours. There is pressure to put up with problematic client behaviour, particularly in care settings, so nursing and social work students, for instance. And often for anyone wanting to come forward about problematic behaviour, there is a concern that little or no action will be taken. In addition to these drivers for universities, there's obviously a desire to present and reduce incidents of negative or harmful behaviours for the sake of the individual students, but there are also implications for organisations on a range of fronts in relation to costs for additional health and wellbeing support where there are impacts on students, costs associated with student attrition, the university's reputation, obviously, and then also potential legal or legislative regulatory implications. So things like positive duty of care to students, psychosocial safety and wellbeing, and also the national code, obviously. So we do know that employers are legally obliged to ensure that there are safe working environments for their employees. So a big part of this responsibility does sit with the placement organisations, but educational institutions obviously have a responsibility for safeguarding their students from harm. And under the National Code, it's made really clear that this includes harms across any learning environment, and that includes WIL and placements as well. The previous webinar did address some of the prevalence data and code related specifications. So if you're looking for more information, I would encourage you to have a look at that webinar as well. So in terms of the approach we took, so this placements module is a bit of a culmination of quite a bit of work over a number of years with different parts of the university. So in 2021, there was a review of WIL communications to students, and gaps were noted in relation to equity and inclusion topics in relation to particularly discrimination and sexual harm. In 2022, following the release of the National Student Safety Survey data, prevention staff at Deakin consulted with work integrated learning teams and discussed different opportunities to address the low awareness of support and report services amongst students, placements and in WIL. And this led to the development of a flyer with key information for students. Then in 2023, we did a bit of an audit of WIL areas within the university and looked at what information and how information was being provided in relation to support and report options for students. And it did show that there were inconsistencies in whether information was being provided, but also the type of information and how much information there was about support services and things as well. And following that audit, it did lead to us to make the decision to make the placements module that we've developed. And that was with the endorsement of what was then the VC's Sexual Harm Advisory Committee, which has since been updated. There is clear evidence for additional information and resources on this topic to be available for WIL students, but uptake really does depend on whether WIL teams connect and work with their areas to make sure that students are able to access these modules and the information being provided. In terms of what we decided we could do to enhance this information as part of the module was increasing the consistency of information, educating students about appropriate workplace behaviours, their own behaviour, but also what they should be able to expect from the workplaces they're entering. Letting students know where to go to report harmful behaviour and raising awareness of the university's support services. And it's also about being proactive about national code requirements. So we were aware the national code was coming, and this was about looking at where those gaps exist or risk areas were and trying to address that. Sorry, it's just a little bit of a delay when I'm trying to click through. So in terms of the phases for the module development, we worked with the learning and development team at Deakin to nut out the different possibilities and work out where we were going to put this, place the module. So it sits on our Cloud Deakin site, which is accessible to both students and staff. And students can also self-enroll in this, so it didn't require schools to necessarily make this a mandatory requirement of students. We did a bit of drafting of content, we mocked up the module and came up with some ideas around potential interactive features, and then ran this by the learning team to work out how we could do this. And we also worked with the Safer Community team and local sector partners in terms of working out how to make sure this was a trauma-informed approach. Taking on this feedback, we developed it into a live module that could then be tested with key stakeholders. So first it went to WIL coordinators and then to students, and using the feedback provided, we did some final tweaks before launching it as a full module. So this is just a bit of a visual of what the opening page looks like. Multiple mouse issues going on at the moment, which is ideal. So the module takes about 15 minutes to complete, and we did want to make it so that it wasn't a really cumbersome requirement on people undertaking placements, because we know there's a lot of information that needs to be provided. And we also didn't want something that made students more nervous about placements where they might already be quite worried about it. So it was about recognising that placements are generally a really positive experience, but if anything does go wrong, this is where you can go to find information. And students can access it multiple times. So if you do it in first year for a placement and then you have another placement in third year, you've still got the access to find that information again and have another go at seeing any updated resources and things that might have been added. So the key objectives are to ensure students understand their rights and responsibilities, know where to get support and when to seek advice, and also explore what behaviours of concern might look like and provide specific details of support options. The topics covered were legal rights to a safe and healthy workplace, intersectionality and power, noting approaches to prevention under the code do require that intersectional approach. Defining sexual harm, and I'll just mention we are currently doing some final updates in relation to the National Code, just to make sure that alignment's really clear with gender-based violence rather than just that sexual harm focus. When to seek advice and support and where, Deakin support services, case studies, and also external support services that people might be able to access if they don't want to go through the university. Our training guru in E&I at Deakin, Alicia Yu, designed all the interactive features of this module, and it was quite a tricky balance to try and find that, yeah, the balance between engaging content and mechanisms for making it more interactive, but also respecting the nature of the content and the seriousness of it. So the mechanisms used include drag and drop, interactive diagrams, multiple choice questions, and embedded videos. Given the nature of the content too, there's also includes content warnings and options for students to contact us for information if they don't feel, because of their own personal experiences, that they'll be able to complete the module. It explores four different case study personas and explores topics of workplace adjustments, bullying, child safety, and sexual harassment, but also aimed to create personas that were intersectional with diverse ages, abilities, genders, and cultural identities, so that people could see themselves reflected in the case studies and also think about the factors that intersectionality can I guess the way that intersectionality can influence the different experiences people might have of trying to come forward about these things. Oops, sorry, I'm just realizing I haven't clicked the right slide through for you, but that's that slide. In terms of review and evaluation, so we, as I mentioned, we had that initial pilot phase where we took it to WIL coordinators for their feedback, also took it to students and also took it to the Sexual Assault and Family Violence Centre in Geelong. That's one of our local partners, just to get that external perspective and make sure it was indeed a trauma-informed module. And then pilot feedback was collected through Qualtrics surveys embedded in the module. Ongoing feedback is also collected through Qualtrics surveys embedded in the module, and looking at the next stages of engagement as part of our current updates to make sure those updates continue to reflect the current needs and national code requirements. The feedback to date, so we've had 1,462 staff and students, very, very much heavily weighted on the student side. I think about 32 of those are completions are from staff. But they reported that 92% learnt new and relevant information, 86% found the content interesting and engaging, and 88 would recommend the module to others. And so that's really positive, and particularly there are some schools within Deakin who have made this a mandatory requirement, and we do know that often feedback can drop a little bit when it is a mandatory requirement, but the fact that people are still saying that they learnt new and relevant information is really positive for us. In terms of the next stages, we are looking to relaunch the module in T2. We work on a trimester system with much more focused coverage of gender-based violence and reference to the national code and updated policies and procedures. We're exploring the development of supporting resources, particularly those that might be beneficial to placement organisations, and considering ideas like, could we do video explainers about what students expect and what Deakin expects from placement providers, or how Deakin can support placement providers to provide a safe environment and how to respond if anything does go wrong. We're continually incorporating ongoing feedback and looking at the impact of it on the whole, and actually looking, next stages are around assessing the role that this module might play in helping students to come forward where something does go wrong. Ongoing support to WIL coordinators and hosting organisations is something we'll continue to look at, and also working with internal Deakin partners to try and expand promotion and impact and increase the uptake throughout the university. So thank you very much. We did publish a Janza article on this if you are interested in more information, so I'll pop a link to that in the chat, but thank you very much for letting me present this today.
Thank you so much, Ariana. What a wonderful example of practice, and the fact that you had this in place actually even before the formal launch of the code really speaks to, I think, Deakin's commitment on this, and a lot of learnings and shared. What I will also just say is I was really struck by, one, the collaborative iterative design process, and really how you took a whole of university approach, which is fantastic. And hopefully there'll be many, many more good practice examples emerging through the insights from the Deakin model. So with that, I'm going to thank Rhiannon for a fantastic presentation, and we're now going to move over, and I'm going to pass the baton over to Laura, because before we jump into the scenarios, we did just want to do a quick refresher of the role of WIL practitioners in the process of disclosure, because we know that that's a key capability. So Laura, I will hand it over to you.
Thanks so much, Carolyn. And Rhiannon, great to see that module going from strength to strength. Very briefly, as Carolyn has noted, we just wanted to touch base on some of the content in webinar 1. If you haven't had the opportunity to do so, I do encourage you to review the recording. There was some fantastic, particularly introductory content covered around the code, but also some content around particularly the trauma-informed approach to responding to a disclosure. One of the things we really did want to stress, particularly for those of us that are GBV practitioners, is that in particular your role as a WIL practitioner. And as you can see there on this particular slide, we did want to note that if a student comes to you with a disclosure or a concern, your role is to listen and to acknowledge and report onwards. And that can be anonymously if required. So if you do have a student that comes to you and doesn't wish to share their information or it's secondhand information, you can reach out to your institutional contact and have that conversation without disclosing any of those details, really not only to seek advice for that particular student, but also to ensure that you're seeking the support that you need. You are not expected to investigate what has happened, and you are not expected to really take on carriage of that, not only that emotional toll, but also responsibility for the further investigation of what has or hasn't happened. This approach, and just to stress too, this approach does align with the legislation, and it really is important about ensuring that those that are trained to follow up these instances and disclosures can do so in the appropriate way. The other thing that's noted there is that really this is an important piece for your own wellbeing, and it does relate back to a variety of legislation around duty of care and ensuring that you have the appropriate support that you need to carry on in this space. The next slide just speaks to, I can't change the slide, sorry, yes, the next slide just speaks to the trauma-informed piece. And really, I just wanted to reiterate the content that Megan covered so well in the first webinar. And effectively, there are these 4 steps that we encourage you to take, which is recognising what a student is disclosing to you or describing to you, and it may not always be obvious. It is important that, as many of you may be aware, some of these instances come to you in a very roundabout way. Often it is coming with a different issue, and then as you sort of unravel it, it can end up or result in a more formal disclosure of some kind. Responding in an appropriate way through empathy and compassion, and explaining the options that are available to the student. And then, as noted previously, referring on to specialist support services with the consent of the student, or in terms of an anonymous sort of seeking support for yourself and for that student as well. The final piece is really working with that specialist team to review what has happened and what actions we can take to support that student and to support future students who might be in this position. And as we go through these case studies, we'll talk a little bit more about that in detail. Thanks, Carolyn.
Excellent. Thank you very much, Laura. And I think that sets us up actually really nicely for the scenario discussion, because one of the things when we were coming together to talk about the planning for this webinar, we had the intention would show lots of good practice examples. The reality is that for a lot of institutions, we're literally in the build phase of the development of good practice. So our plan B was to say, well, we know this is happening and it's happening consistently. So what we've got now is we're going to present 2 case studies to you. And what we're going to do is we're going to share a case study and put a slide up that kind of frames the particular scenario. And what we're then going to do is we're going to have a WIL expert respondent along with a GBV expert respondent, and we're going to look at each scenario through these 3 particular lenses. The first bit we want to look at for each scenario is what are the key issues, risks, or concerns, and we're going to look at that through 3 different lenses: the risks for students, risks for staff, and risks for the industry partner, which very much aligns to our new WIL quality framework. So the first bit is kind of, I'm an English major, like a critical reading of the scenario and surfacing. That will then lead into, okay, now that we understand what the key issues are, what are the potential immediate responses that need to occur? That will raise very much the duty of care to students. It will also raise things like, confidentiality, privacy, different systems within the university. And that'll be the second thread. And then the third part that each panelist will explore is again, what's the preventative work? Because if there's one thing from the code that I think is really exciting, it's about saying this isn't just about the immediate response, it's about changing the culture. And that's where that longer term view. So I'm going to now shift us over into the first scenario. I'm going to share it and outline it. And then again, we'll scaffold each question. And I'm going to throw it first to Faith. For the scenario one, I'm happy to report that we have Faith and Larissa tag teaming, and then for scenario two, it'll be Faith again with Laura. Excellent. So with that, I'll move the slides. So so scenario one, a nursing student on a rural clinical placement discloses to her WIL coordinator that her placement supervisor, a senior clinician, has been making sexual comments, finding reasons to be alone with her in supply rooms, and last week placed his hand on her lower back and left it there. She is 2 weeks into a 6-week placement that she needs to graduate. She doesn't want to make a formal complaint to the health service because, quote, he runs the unit and everyone respects him, end quote. And she's worried about her clinical assessment. And so she's now in this scenario, she approaches the WIL coordinator and is asking what she should do. So that's the scenario. And what I want to do now is we're going to start by, I'm going to invite Faith to kick us off. What are the key issues, risks, and concerns of this scenario?
Well, I'm not sure about anybody else in the room, but this scenario, I have a massive sinking feeling when I hear this scenario. Not for any reason other than it is such a complex space to navigate, and particularly in health and other accredited placements, you're managing the student completing their placement, you're managing the relationship with the partner. Often these placements are paid, they're organized way ahead of time, and it's not something that you can easily pick up and reallocate a student to another or a new placement. So as a WIL practitioner, and I'm very keen to hear about other people in the chat, this becomes immediately very heavy and immediately something that you have to navigate, given you've got to support the student, manage the partnership, and you've also somehow got to navigate your way out to a successful solution for all the stakeholders involved. And I'm sure everybody takes a different approach to how they manage this, but I guess from a WIL practitioner point of view, the starting point is always the student. We have a duty of care to the student. And this is where I find these complex scenarios, I really invite the panel to jump in and give some guidance about what my obligation is as a WIL practitioner. And then Caroline, and I'm sure you and Laura will be keen to provide some information about how do we safeguard that partnership with that partner? Is this someone that we want to continue a partnership with? Often it's not that simple an answer because you've got so many students going through, and health and allied health are so complicated. So keen to hear from Laura about what I should do as a WIL practitioner in this space. I just
So
Larissa,
so we've got
Larissa,
Faith.
sorry.
So Faith, you've laid out. We've got the scenario of how do you respond to the student. We've also got the complexity of a student about to graduate, the paid placement, and then also the navigating of the relationship with the industry partner. So you've mapped out from a WIL perspective. Now I'm going to hand it over to Larissa. What would be the key risks, concerns if we look at this just purely through a GBV perspective, Larissa?
Thanks, Caroline, and thanks, Faith. And I do want to acknowledge that this is really difficult work from people that are working in the space, both in the WIL, from the academy, as well as the support person that may end up supporting the student through. And it's so based in context as well. So you might have some options if you're talking around a major metropolitan area where there might be a lot of options. In this case, we're looking at a rural clinical placement where the options for alternatives are more likely to be limited. So we do acknowledge the complexity that you have to navigate. And I think, as Laura mentioned earlier, in all your universities, you will have a gender-based violence support team. And their role is also to support you. So I really do want to encourage you to reach out to them and don't feel that you have to navigate things alone, because I think between them and your expertise, that's how hopefully we're able to get the best outcome for the student, but also for the partnership, etc. So in this particular case, there are obviously sexual harassment issues happening that we do need to take into consideration, and also the power imbalance that is so visible, not just because this is a senior clinician that is very well liked. We mentioned before, we're talking about a regional or a rural clinical placement. So if this student wants to stay in that particular placement, maybe this is their town they're from, their options are going to be limited, and they're so close to graduating. So things that we sometimes hear from students is, I don't want to put a complaint, I don't want to do anything because I just want to get done and graduate. So that there is a potential risk of ongoing harm for the student because she still has another 4 weeks of placement. And as an institution, we do have responsibilities, not just under the national code, but if this was to be an international student, obviously there's also responsibilities that comes under ESOS, and just general, the Higher Education Support Act requires us to be able to put the health and the well-being of the student together. So in terms of as a gender-based violence support, what we would do, or what you can actually do in your place is, first of all, is just validate that disclosure. It takes a lot of courage for people to come forward and to disclose. And the way that they experience that disclosure, or how that disclosure is responded, can have a massive impact on how that person's healing or further seeking of support can be. So again, you don't have to be an expert support in this space. You just do that human response that I'm sure you're already doing because you're having to deal with these complexities. So first thing is around validating, thanking the student for trusting you to actually coming forward. I think we would be checking to see if there's any immediate safety concerns for the students. So that risk assessment in the model that that Megan talked to you in the last workshop is really important, because obviously if there was to be any imminent safety concerns, we will need to address that. And again, you don't have to do it alone. There will be protocols within your university, or this is where, again, that referral to those support services is really important. The other thing that's really important is to really explain the boundaries of your role. So again, Laura mentioned earlier, your role here is not to investigate, to go and force the student to take a complaint or not to take a complaint. Your role is really to validate that they have had, that experience, validate that you're going to be working with them around exploring options, and obviously explaining what it is, the role that you're able to support them with. And also talk to them about that referral pathway to whatever the appropriate support services are within your institution. And maybe start considering with them what might be some placement adjustments, or if you're going to be limited by those placement adjustments, being very clear and upfront with them, because what we want to do is to make sure that we're not making any promises that we might not be able to keep, and then that could diminish on the trust. I think in terms of longer term and how do we actually manage the relationship, as Faith said, this can be very, very tricky. But I think it could be around conversations with that particular provider around, hey, did you know that we actually have new legislation that's coming into impact into university that requires us to actually do X, Y, and Z? As part of this, our students are being a lot more educated and informed around, what gender-based violence looks like, what are the alternative pathways that they can actually take, and if possible, offer that provider to come in and have a conversation with them, because a lot of this information is going to be relevant to them under the Positive Duty Act, under the Sex Discrimination Act that would apply to them. I think having those really broader conversations around academic progression are also going to be really important, particularly the student is so close. And also reviewing some of the policies. So as Caroline said, one of the things that the national code requires us to do is to be proactive and to also look at the disclosures that we're getting for patterns that enable us as institutions to really start taking that proactive approach. So what are the kind of things that you might be able to include in your will contracts? What are the kind of information that you should be giving providers or your will, partners, so then they have an understanding that students are going to be a lot more capable in actually identifying these kind of behaviors. There's a question in there in terms of documenting. This will mainly depend on the processes within your institution. At my institution, for example, what we have is what we call a de-identified disclosure tool. So if we don't actually have the consent of the student and I receive a disclosure from a student, I would be required to put a de-identified where I can actually say, this happened while the student was undertaking will. This is the kind of experience, but I actually don't mention anything about the student. And this allows our institution to have a look at those patterns and to actually have a look to see, is there a particular host that we need to be more proactive with? And I guess in terms of the privacy issue, again, this is where those conversations that you need to have with the student are really, really important, and to have those very clear boundaries. Obviously, in order for you to be able to explore alternative placements, you will probably have to disclose the name of the student to other parties, but you might not necessarily need to disclose why. That conversation about the why is actually something that you can keep private. So I think it's that negotiation that you need to do with the student. Obviously, in terms of the referral to services, that referral needs to be discussed with the student, and the student does need to consent in order for the services to accept that referral. But again, this is where the boundary conversation is really important, and that having really clear expectations in terms of what information you need in order to facilitate things.
I have a quick question. Oh, sorry, Caroline. If the student has to finish, and like, for example, I'm in a regional area, I have real concerns about sending the student back into that placement based on what they've disclosed. Then what should I do?
Listen, and I take Laura and Rhiannon and Megan, feel free to jump in as well from your experiences. I think that this is where some of so under the national code, one of the things that particular areas like your response area will be required to potentially, if the student presents to them, to undertake a risk assessment. And I think that this is where that link and connection with the support areas will be quite essential, because they will be able to go into I guess doing a deeper risk assessment of things that you as a will practitioner will not be able to ask and will not be able to assess. And that recommendation might then need to come back to you to say, we actually need to put some safety measures in place for the student, which means we won't be able to send them back to that placement. We must look for alternatives. So I think that that's where that conversation and that referral is really, really, really important, because that risk assessment component is also a requirement under the code. But Laura and Megan and Rhiannon, if you've got any other thoughts in terms of how we manage that, I welcome your views as well.
No, I think, Larissa, I would just agree with what you're saying. It really is a collaborative program of work. And so, relying on that specialist service to provide you with the guidance to have those conversations and to know what's required is really critical, and also supports you in making sure that, you're not feeling that you're going home at 5 o'clock and that you've got this awful scenario playing out without knowing what to do.
Can I just step back, because I think it's interesting around the GVU. I'm just going to bring back the will perspective here, and Faith, maybe for you and I to tag team on this. I think, Larissa, you've already signaled the power of your policy levers, and just making sure that you're building into your policy, particularly into the procedure, into your guidelines. Also, when you're doing the risk assessment, that you've got contingency plans. So if there's a catastrophic event, this I would categorize that as this. You actually have already a plan in place for how students can meet their obligations of their program and course. So that's something I think at a policy level being clear. The other question I had was, in a lot of these scenarios, we have multiple students placed at the same time. And so two questions I have is, what's the duty of care to potentially other, because that would be a risk, are other students being impacted? And then the other question I had is actually for a lot of us in the will space, we have a policy and a procedure, but we also have delegations. And when student conduct issues occur, the other bit I would add into the layer is making sure you're aware of who your senior decision makers are around will, especially if it's about managing the industry relationship, and that. So I'm just keen to hear, and Faith, feel free to chime in as well for you and I to tag team. I guess the question back to Laura and Lursa is how would we handle potentially other students on placement, and just the delegations question as well.
I think for me, in terms of the other students on placements, this is again where your risk assessment that your prevention team will support. And I think this is where the partnerships are so important as well. And again, this is where for you to find out what are the mechanisms within your institution for reporting or disclosing, whatever the language that you use, because again, if this is a pattern of behavior that has been reported to you as a will practitioner many, many, many times, obviously the risk and the things that the university will need to put in place to mitigate those risks are going to be very, very different to that if the situation is different. So I think that partnership is really important. And I think that this is, again, like the beautiful example that we got from Rhiannon, how we preparing our students to be able to identify what is actually gender-based violence and other harmful behaviors. How are we preparing our students to actually be able to have the conversations around the agency that they do have, and to be able to report or to speak out is going to be really, really, really important, because this situation, I'm sure many in the room, and as Faye said, you probably have faced something fairly similar. And even as a gender-based violence practitioner, I still get that sinking feeling in my stomach when I come across these kind of things. But I think the more that your students are able to navigate and to understand those behaviors, they're also the more empowering that you're giving them to actually be able to then take the steps that they need to. But Lauren, I'll pass to you as well.
No, I think you've covered it really well, Larissa. I know Megan's popped in the comments there. It is very context dependent. We know that there is significant reputational risk for the university in either direction. Failure to act would have reputational risk as well, but also we know that acting and potentially, removing a placement partner has implications. So I think that, there are a number of conversations that need to be had with those that are senior without necessarily disclosing a student's identity, but making sure that we are covering all bases.
So I'm just going to wrap this scenario up. So we've got understanding it from the student perspective and the duty of care, and some really thoughtful comments there. I think, what I'm also hearing from a will ecosystem is making sure your policy and your procedures are fit for purpose and aligned, being really clear on clear delegations, because that's often something that can have significant risk if you delay and you don't know who has to be informed. And then also what I'm hearing as well is thinking about it in terms of the ecosystem with the industry partner, and again, your infrastructure for reporting, and how those data pieces are connecting. And that's actually one risk, is often one piece of data sits over here. And especially the other factor would be to look at, do you have a centralized will operating model, or do you have a decentralized? If it's decentralized, then also thinking about, if you've got multiple placements of health students, but also business and IT, and again, just making sure that the dots are connected. So that's scenario one. We're going to move now to scenario two. And again, we will make this PowerPoint available. So in terms of the second scenario, a student joins a placement team where humor, teasing, and informal socializing appear to be a part of the workplace culture. Comments about appearance, relationships, and gender stereotypes are common and usually laughed off. Women are also often asked to organize team lunches or take notes in meetings, while males seem to be encouraged into more visible technical tasks. When the placement student raises discomfort, another staff member responds, quote, "Nobody means anything by it. You'll need a thicker skin in this industry to survive." and the student reports this interaction to a WIL staff member and asks for help. So if we follow the format, Laura and Faith, what are some of the key issues that we would note, the key issues, challenges, and risks of this particular scenario?
So Caroline, when I first had this, I was actually faced with a very similar scenario years ago. And what I had to do was actually look at my own internalized misogyny and bias. I used to work in newsrooms where this kind of culture, dark humor, was very much part of the workplace. So it's really about acknowledging that this kind of behavior in workplaces does have an impact these days. And I really need to, first of all, support the student. We owe the student a duty of care, whether that does happen on placement or it doesn't. And there's so many subtle layers in this scenario around task allocation, the sexual harassment that's occurring in here. You've got a lot of power dynamics. So first of all, we need to tell the student or validate the student's experience. It might not be something that I feel is as concerning, but if they do, then that's the first point of call that we need to do to actually take the student's experience into consideration. If I go back to the partner, they have a workplace health and safety and sex discrimination requirements within their own workplaces. So again, it's not as clear cut as the previous scenario, but again, it's still something where you have to navigate your duty of care to the student, your relationship with the partner, and I'll be going straight to my support service team and saying, okay, what do I do here? Once I've made the student feel comfortable, then again, I'll be going back to Laura, Larissa, Rhiannon, and Megan and saying, okay, help me navigate through this because I'm really not sure how to manage it.
So Laura, that's a nice handoff over to you.
Yeah, and I mean, Faith, you've covered a lot of the core issues there. There's certainly some general issues around workplace humour and gender stereotypes being normalised, the unequal distribution of tasks, and the student really feeling uncomfortable. And I think what I love about this scenario is, in this particular instance, we don't know the gender of the student involved, and we also don't know whether they're actually what their expectations are in terms of asking for help. So, being clear, are they asking for confidential assistance and support, or are they actually wanting to report this in terms of a formal report or disclosure and make a formal complaint?
So can I just step back, because we've got the student. I guess one of the things I'm also wondering about is if the dynamic is what could we be doing as WIL practitioners proactively when we're looking at different industry partners? So any thoughts on what we could do preventatively in this scenario?
Yeah, I mean, certainly, I think Larissa touched on a couple of options here, and I appreciate all of these often exist in a perfect world where I know that certainly from my experience, many of the placement agreements that universities have in place have been around for decades, and there may not be formal agreements, they may not be documented, but I think that this is actually not only a necessity, but a real opportunity for the sector to start to review those kinds of placement agreements that are in existence and looking at opportunities to actually pop in formal clauses and information about the National Code. I know Larissa also touched on, having proactive conversations with placement partners about the legislative obligations that universities have. And also workplaces themselves will be aware of their own workplace legislative obligations around positive duty. So it's a really productive conversation, I think, to have upfront, as well as, rather than it being reactively, I guess, when some of these instances occur. And I think considering this legislation is now in place, it's actually the best opportunity to do so with that as your backing, rather than it being this out of the blue kind of, we're doing this, but we don't have any reason necessarily to do so. We've actually got a real impetus to make changes now.
one bit I would thread in is when you look at your risk and due diligence, and Faith, you mentioned, that different sectors will have different, often risk or different cultures historically. So one thing I think that when we're doing our will risk assessments, being aware of those cultures and making sure that the level of due diligence and risk assessment is aligned also with that, so that you might have a higher threshold, for example, if it's a new partner or if it's within an industry that doing something as simple as checking does the organization actually have at a policy level, or even going onto their website just to see how they're framing. Again, you can get a lot of insight into the culture of an organization around that. I guess the question around, I'm going to throw a little spanner in the wheel here and just modify this scenario slightly. How would it change if the staff member was actually a university staff member? So that, they might be going out into a placement and they come back and they report to a university staff member, and it's a university staff member who has that response. How does that potentially add another layer that we might have to think about?
Thanks.
Sorry, Faith.
No, I was going to go, thanks for that. I'm going to go to Laura.
I will say that's not, sadly, I have had that experience in the past. I think, we are going through a period of significant change where some of these behaviours have previously been normalised and certainly expected in workplace cultures, but we are finally, I think, reaching, a phase where we can actually call this sort of behaviour out. I do think, that's a really good opportunity for a private conversation with that staff member in terms of, that discussion of gender norms and around, and again, if it means referring back to legislation, if that's your fallback, I think that is that really good opportunity around, like, this isn't just like a nice to have anymore. This is actually, a requirement of the law that we are taking action as a university, as an institution, and also your duty of care as a staff member of that institution. And I would like to think, if not already in place, most institutions will have covered, will be required certainly to now cover gendered norms and drivers of gender-based violence as part of their induction programs, but also as part of scaffolded learning that should be in place. Not to say that that's kind of training solves all manner of problems, but certainly it is an opportunity to refer that staff member back, depending on the nature of your relationship with them, but to refer them back to that kind of education and training.
The reason I was asking that is because, a lot of universities are creating the infrastructure around gender-based violence, and they're creating modules that are broader modules for staff more generally. And that would be just one thing when I'm thinking about my own role as, one of the will decision makers at my university. It would be then saying, okay, let's complement maybe that more broader, and working in partnership with our GBV experts to have a more situated conversation, for example, with will course conveners, so that they're proactively understanding what they might expect. So the more we can equip that academic who's on the front lines with the knowledge, insight, and confidence, the more then hopefully we have a good response. I guess I'm interested in, just before we close it, just any final comments just on this scenario in terms of longer term interventions.
Certainly from my perspective, I think, and Larissa has touched on a number of these, but it is that, I think, reviewing of placement agreements depending on your role in the institution. I think that the placement module is a great example of one such action, universities can take. In this instance, because I was involved in that particular module, there weren't no easy answers to how we actually educated students who were going on placement, and we started with the option of it being an optional module, but worked really closely with academics and will coordinators for them to embed it and make it part of assessment. And I think that was a really critical piece to the puzzle, was that it wasn't just another add-on module for a number of students. It was actually integrated as part of their learning. And a lot of them created assessment tasks around the scenarios that we had and the case studies that we had in the module. So it became this really embedded part of that placement journey. Now that's taken time, and it wasn't certainly an easy journey, but I think that there are a number of options around having that prevention-based approach to education, not only of students, but of placement providers, and providing them with that information around the national code in a really digestible format, not, burying them in legislation, but saying, as a university, we take this duty of care responsibly, and this is the action that we're going to be taking, and this is how we would like to partner with you on this to ensure the safety of our students in your workplaces.
I think that's a good comment. I might leave it at that one just for that scenario, and we do just want to open up the floor Is there just if there's any questions from the floor, either related to the two scenarios or more broadly? Again, we've got about 5 or 10 minutes just for any questions.
There's a question for
Yeah,
Rhiannon.
excellent. So we've got a question here. What is the timeline, Rhiannon, between students completing this prior to their first and subsequent placements?
Yeah, so it does vary a little bit, but we try and advertise and promote it right at the start of each trimester so that when they're going on placements, they've had a few weeks to digest that information, a few weeks to actually get that module done and then continue on with it. Some of the schools, I believe, are providing it the trimester before to give them a bit longer lead time. But yeah, it does vary a little bit, but we do a bit of a campaign each trimester with digital signage and things so that students who might be attending placements who don't get that information from their WIL coordinators have the opportunity to find that information as well.
Thank you. Any other questions? Yeah,
I have
go ahead.
a quick question. Sorry, Caroline. You mentioned you've got centralized WIL units and dispersed WIL across faculties. What's the university obligation to make sure that all of their WIL teams are aware of A, the code, B, what their obligations are, and what our institutional processes are? Because I'm just thinking, should I be sending out an email to all of our WIL teams who are not centrally located? Is there an obligation on the institution to make sure that their staff are aware of the code in this space?
The short answer is yes. So the approach that we, for example, take in our institution is holding, a variety of workshops and awareness, but also then having the conversations with the individual areas. So we will be convening our WIL staff, and in a couple of weeks. And actually, some of this was thanks to this amazing workshop that WIL Australia has put together to really have the conversations around that coordinated approach. And again, this is a collaboration, right? This is not you over there need to do this. This is about how do we as a whole of institution, and that's a very key thing of the code. The code is expecting a whole of institution approach to how we actually respond and prevent this type of behaviors.
Faith, what I might just add to that is I think the key bit in that scenario is also to differentiate between a decentralized WIL ecosystem and a centralized. Your two most powerful levers in that scenario are actually going to be your WIL procedure and your WIL policy. And usually that will sit at whole of institution. But if your policy and procedure make really clear delegations and responsibilities, that creates then the lever around it. So not just do they sit centrally or not, but it's really making sure that the responsibility alignment sits at the appropriate level with delegations. So again, that's something that a lot of institutions are revamping their WIL policies and procedures. But again, those are your two, really powerful levers, I think, structurally. We've got
there is the question in the chat. I just wanted to bring your attention to.
Yep, absolutely. Do you want to read it out, Linda? Yeah, sure.
So what to do where two students are on placement and one reports the other regarding behaviours? How can this be managed? For example, the role of the industry in that process, which is a really important conversation.
We might invite Laura and the GBV and Larissa to take that one. Yeah.
Well, if both students are from the same institution, then your code of conduct will be applicable. So I will probably be having the conversation in terms of how it gets managed. I will be having the conversation with the person that has experienced the harm around, do they want to go through a formal process? Because your code of conduct would be applicable in most situations, particularly because the students are there on university purposes. I guess in terms of how I would manage the placement, you probably go back to just focusing on the person that has experienced the harm. What do they want to do? Obviously, if it goes through a formal process, your institution might have particular procedures in place. That means that maybe one student might have to, sit out of that placement while the investigation happens. So I would probably put it through that, but still have the same trauma-informed approach in terms of how do you actually respond. being mindful that the national code also requires institution to provide information and support to the person that has caused the harm. So making sure that the person that has caused the harm, if they also approach you, that you actually refer them to those support services, so then they're also able to navigate what their role and options might be.
So with that, we're probably going to need to leave it there just because we're at time and I want to respect everybody's. But I just want to extend, just on behalf of WIL Australia, our sincere thanks to all of our fabulous panelists today. Thank you for the generosity in sharing all of your insights and your expertise and knowledge. And I think for me, today's webinar has really highlighted that a lot of these issues are very, very complex. There's multiple layers across, but I think for me, one of my strongest takeaways is the strength of the cross-sector dialogue that we can have, and the importance of for the WIL community. We're not in this alone. We have fabulous GBV experts, and if anything, I think this new code has opened up space for conversations that we would hope would be happening in our institutions, but creating more cross-institutional partnership, but also the work we're doing right now, which is as a nation tackling this. Because again, I think I go back to this is about a generational shift, and when we think about at the core of the code is this concept of shared responsibility. So it's lovely to see it mapped in our webinar today. Just quickly, there will be more, but our wonderfully generous GBV partners will also be working in partnership with the WIL Engagement and Advocacy Committee to create some support resources. And again, I think Rhiannon, your point around we need a lot more resources, but let's also take maybe a cross-institutional approach and share our insights and our practice. So again, a warm thank you to all of our panelists. I also want to give a shout out to Linda Jaffrey and Faith Valencia Forrester for taking really the conceptual lead in bringing all of this together and bringing it to you. So everyone, travel well. It's very cold and soggy in Queensland, and as a Canadian, I need a good jacket. But thank you for your engagement and participation today, and onwards with this really important work for all of us. So travel well, everyone. Thank you.